we've never had a perfect NHS, and we never will have. It just happens to be one of the best, worst systems in the world because it allows access for anybody, regardless of ability to pay, and it has always been a comprehensive service. This is what's under attack, and that's why I've said the NHS is going to deteriorate, and it's going to deteriorate for two reasons. I think what we're fighting for is the principles of the NHS. We're defending the principles of the NHS, we're not defending bad practice in the NHS. We don't think the NHS is perfect. And the reason that we have a shrinking NHS that is for sale is because of the NHS Act that's just gone through, because it's about privatisation, it's about breaking up the NHS into small units and selling them off. And you've got a classic example up the road, I understand, with the GP surgery that is privately owned and bloody awful. And this is absolutely shocking, but typical of what is going on across the country, wherever the private people get in, because essentially it's profit before health. But the second thing that forms the double whammy is the £5 billion efficiency savings each year, where this is the first year. We've got another 4 years of this, and then more on top. And of course, we've had the Chancellor's statement today that they say they're going to reserve NHS funding, but in reality, NHS funding is going down, and it's going to go down very quickly. But just look at the first one, PFI, the Private Finance Initiative, used to build hospitals and schools, now admitted both by Labour and by the government as being full value for money. In other words, our tax money has been shoveled in huge quantities to the private sector through building programmes. And the biggest campaign going on at the moment in the NHS is in Lewisham in South East London, where the major cause of the collapse of the hospital is the Private Finance Initiative, and the government is offering to bail out the PFI by putting more money in, which of course goes straight to the investors, not to the NHS, which I think is utterly appalling. We have had increased funding in the NHS, and we are approaching the average of the European Union, but we're not there yet, and we're just about to slip away again. The coalition government came in and said no top-down reorganisation of the NHS, and then produced the biggest reorganisation, or the disreorganisation of the NHS that we've ever seen. They lied about the NHS, and they continue to lie about the NHS. Only yesterday, the Prime Minister and the Secretary of State for Health have been asked not to repeat the mantra that the NHS funding is going up year on year, because it isn't true. And they were asked yesterday by the National Audit Office to shut up and stop saying it. So they continue to say that the NHS is lousy, that the stats for the NHS don't bear any sort of comparison internationally, which is not true. And they keep on saying this is not privatisation. Well, you've got a GP surgery up the road that proves that's not true. Where are we now? Nobody really knows, and this is crucial to understanding the importance of these meetings and what you can do as a group. These meetings are typical now of what people are, as people realise what's going on in their NHS, they want to do something about it. And all the nonsense that's been talked about in the run-up to the Act over the last couple of years is now being shown to be simply not true. There is a market going to be created in health. There was one on the way under the Labour government, which has been continued. It's now going to get massive. And I put up here elements of market. I'm not going to go through them all, but look at the bottom two. Easy entrance and exit. This is a government phrase. They want people to be able to get into the health market, and they want people to be able to get out. In other words, winners and losers. Now that's not really a picture I have for an NHS. And yet here we have it. And the efficiency is all about profit before health, as I've said. The Act comes into effect on the 1st of April 2013. These things are already happening without the Act being law. We know that the country is in austerity and problems and all the rest of it. That's not our fault, actually. And nobody seems to be held account for this at all. But nevertheless, the effects of that are that there are cuts going on in our health service as we speak. It is no longer automatic that you will get what you've already accepted as being part of the NHS, whether it be these hips and knee replacements, and simple things like physiotherapy is being cut. You won't be able to get it very soon. You'll get one assessment and you'll be told to go away. At the same time, there's massive restructuring with primary care trusts, the current organisers of health being scrapped, the strategic health authorities and ECTIR being scrapped, and instead we're getting these GP CCGs, clinical commissioning groups. And GPs who have no experience in commissioning healthcare at all are being put in charge of your health service. What's all that about? Well, of course the GPs won't be in charge. It'll be the managers that support the GPs that will be in charge, and it'll be the managers coming along and saying, we actually don't have the money to do what you want, doctor, I'm terribly sorry. So the power of the CCGs I question massively. I do not think that CCGs will be able to have the power to devise local services to your benefit. Moving on, so what will the effects be? Well, I've already said the effects are already happening in terms of cuts in services, but the key messages of what's going to happen is that your service will be fragmented. I keep on saying your service, of course it's my service. I mean, I'm a patient now, and I'm retired now, so I'm a patient, and it's my service that's going to be fragmented. And we are going to find that the trust that we've got in the GP will be compromised. We're already going back to this surgery up the road. At the moment, most people trust what their GPs say on most occasions. Most people on most occasions. That will no longer be true because the GP will be pulled by the responsibility of these clinical commissioning groups, staying in budget, the responsibility to the practice, making sure they stay in budget because they will get paid by the CCG if they stay in budget. So lower referrals equals more money to the practice. Again, not a health service I recognise. And also some GPs have their hands in the till. They are owning private companies that are contracting back to the local clinical commissioning group. And that seems perverse to me. So you've got GPs that are owning the practice up the road that will be contracting to the CCG. It just seems really ridiculous. In the bill is a line that says your hospitals will all be turned into what are called foundation trusts. And currently, between 3 and 5% of their income is earned from the private sector. The cap on that has been lifted to 49%. Okay? So a hospital that gets in trouble, what's it going to do? It's income generate, it's going to up its level of private practice, it's going to make it more difficult for people to get NHS care, so they have to go privately. People on the NHS waiting list will wait longer. It's denied, but why else would they lift the cap? So it makes sense to me. Failing services is pretty obvious if you've got less money. I mean, there's no magic about GPs and money. They're not going to be able to make the money go much further. They may be able to tweak services and reorganise and do a bit, but they're not going to be able to cover for the sort of cuts that we expect over the next 4 years. And so there will be a loss of the continuity that you expect from GPs. There'll be conflict of interest when you go and visit your GP, and the services will become more and more fragmented, leading obviously to more anxiety. In terms of campaigning, this meeting represents what's on that slide, that we're moving from a national fight to a local fight, because we've done the bit about the bill, and the bill is now an act. It's now up to people locally to bring the fight to the powers that be locally, and to resist what they're trying to do to the NHS locally. Now, I'm not sure that you have a particular fight locally, but you do have a CCG, Clinical Commission Group, that is up and running in shadow form. And the pressure from nationally from KOMP is to try and get the Constitution more as friendly as possible to the NHS within the law. So that is one possible campaign. I've been talking to Christine about trying to get patient participation groups meeting, and it is quite difficult to force the practice to hold a meeting of patients and to listen to what patients have to say. But nevertheless, we're locked here, and I'm sure that there could be pressure brought to bear on local practices. The other things are fairly obvious, I'm not going to go through it, but I think linking campaigns may be important, not just health campaigns, but other public sector campaigns where there are cuts in all sorts of things, including, of course, of benefits, which is causing a lot of problems. Keeping up the pressure, I think, is very important. We were talking, there's a new party been formed, it's called the NHS Action Party, and it's been formed by a group of doctors, in fact, but it's open to anybody. And they've done that because they're so frustrated with the political process and want to put pressure on the Labour Party, on the Tory Party, Lib Dems, but also to put pressure on the BMA, which held a very lacklustre campaign over opposing the bill. And a lot of us are very fed up. So there's been a reaction. And they will help keep the publicity about the NHS at a national level, if you like. I think they will keep pressure on the Labour Party because the Labour Party are likely to go big on the NHS in 2015. They may very well win the election, but it's no good if they do exactly the same policy as they did before. So we want to make sure they have a decent policy, and we want to make sure the pressure is maintained so that we can hold them to that policy should they get into power. I've said about local CCGs and practices, that's really crucial, and the postcards that are going to be handed out, I think. But these are postcards that KOMP has produced, which simply say, I want to be referred to an NHS provider in all circumstances where possible. I do not want to be referred to the private sector. Now, that's expressing a preference, and the government says this is all about patient choice. So here's one choice you can make. It's a card to your GP. I think there are reasons to be confident, and again, look at the turnout to this meeting. That's one reason to be confident, because the NHS does affect us all in one way or another, whether it's personally or whether it's family, whether it's friends. We all know stories about the NHS, and we all know how important it can be, as well as knowing it can be improved, and that should not be hidden. I've said already that the service is likely to get worse, and therefore one of the things you need to be doing is spotting what is going on to the local health service and putting pressure back up the line as a group, because as a group you're incredibly powerful. I've said that it's the same story in education and benefits and so on. And so the public will become more aware, more angry, and here you are, the public, becoming more aware that things are not good in the NHS, and it is the institution above all others in this country that we cherish. And here it is, being taken away from us by sleight of hand, which is absolutely disgusting and I think has to be opposed at a very high level. The general election looms.